Hello parents, this is a video information about febrile seizure. If your child has seizure or convulsion with fever, then it is called a febrile seizure, usually seen in children between 6 months to 6 years of age. Sometimes it can be seen even in smaller children or children more than 6 years of age, but the usual age is 6 months to 6 years, and it has a very high genetic predisposition. If you or your relatives nearby had a febrile seizure or an epilepsy when your childhood time, then it's very high that your siblings or your children may have a febrile seizure. There are two types: simple febrile seizure, complex febrile seizure. Simple means if a child has a very short duration of seizure, just one seizure in 24 hours, it's called simple febrile seizure. But if there are multiple seizures, more than one in 24 hours, or a very prolonged seizure more than 15 minutes, or if there is a focal seizure, because usually simple febrile seizures are generalized seizure, big seizures. So if the focal seizure, it fits into a atypical or a complex febrile seizure. Simple febrile seizure does not need any investigation, does not need any treatment, but midazolam spray has to be kept in for all the children who had a febrile seizure till the 6 years of age. But if the children fits into a complex febrile seizure, those are the group they need further investigation in a form of MRI or a EEG. And it's very common to see a children who come with a very abnormally reported EEG from outside, which is actually not the right report. Usually the EEG is normal in a febrile seizure, so it's very common to see the children getting in treatment of epilepsy for a febrile seizure. So it's very highly recommendable that if your children has a febrile seizure who had abnormal EEG, to definitely get it rechecked by a pediatric neurologist, because your child might be unnecessarily taking the medications which is not required. So just a simple midazolam spray may be very helpful, but if your child has recurrent febrile seizure, if they have a very prolonged seizure, some children, they do need medications. So parents, definitely meet a neurologist, confirm your diagnosis, get a EEG reported, and plan your therapy. Thank you.